If you have chronic pain or literally pain all over your body, chronic fatigue, chronic fibromyalgia, chronic joint pain, or simply have joint osteoarthritis, commonly in your shoulders or in your knees, or if you have shoulder pain or knee pain and have been told surgery is the only option, you need to listen to this video. Has anybody ever explained to you the correlation between your gut function and chronic pain? I'm going to guess no. And the reason is most likely because you have not visited for your symptoms an orthopedic functional medicine doctor. These are the doctors who attempt to prevent surgery and not the opposite, or recommend you to go under the knife, even if you're bone on bone. There are treatments available. To get successful results with getting rid of chronic pain, I need to explain to you the link between chronic pain and your gut and brain function, which is one of the reasons we get the results that we achieve to get, and we have happy patients at Medwell Orthopedic and Functional Medicine. When you have pain or when you have osteoarthritis, osteoarthritis is the degenerative condition. There is degeneration happening in your body. It not only affects one joint, it chemically affects other joints as well, and there are other contributing factors which are commonly overlooked by many. You need to understand, when you are in pain, besides affecting your body or a single joint or feeling the pain only in one joint, it affects your brain function, specifically your midbrain. As a result, it affects neurotransmitter transformation and neurotransmitter activity, predominantly serotonin and dopamine. Guess where they get converted and become active? These neurotransmitters that are active in your midbrain, they need to start their activation in your gut. So if your gut is not functioning properly, your brain is not functioning properly. And this is the missing link for the people who have had other treatments without satisfactory results. So you need to understand, bad gut equals bad brain. Inflamed gut equals inflamed brain. What are the symptoms of inflamed gut? Feel bloated, distension, indigestion, food sensitivities. If you have any of these symptoms, you need to address them for you to get better results with even taking medications, with getting injections. There is a direct correlation between your gut and brain and degeneration of your joints, in your knee joint, in your shoulder joints, when you have knee osteoarthritis, so on and so forth. That is why when we treat you for pain or knee joint osteoarthritis, besides giving you gel shots, besides giving you bracing, besides giving you physical therapy or our new insurance approved injection which forms cushioning and regenerates cushioning that is missing around the joint to lessen the chance of surgery. Besides that, we look at the whole body commonly, starting from your gut and brain function. That is, even if you're bone on bone. We look at your gut function and brain function to help you. What are the common signs of brain dysfunction? Mental fatigue, depression, anxiety, sleepless nights. Many of our patients who come to this office, we look at those systems of the body, and when we address them, when we address your gut, when we address your mental clarity, when we address your brain dysfunction, you get much better results, much faster. Obviously, results vary. So if you feel bloated after a meal, if you have indigestion, if you have gluten sensitivity, the only way to know is to get tested. It's not by what you tell us. You need to get tested, and we do testing. And we address your gut and brain dysfunction while we treat you for joint pain, while we treat you for chronic pain. That is what makes our functional medicine doctors different when it comes to orthopedic conditions. Even if you're bone on bone, even if you have been told surgery is the only option, even if you have been told you have to take medications for the rest of your life every day to just mask your symptoms for that day. Do you really want to do that? Do you want to be dependent on medication and mess up your gut function, mess up your liver function, mess up your kidneys? Your gut function should never be ignored when it comes to any chronic illnesses. That includes thyroid problem, autoimmune problem, neuropathy, knee osteoarthritis, chronic pain, chronic fatigue, low energy. Proper gut function is paramount for your well-being. So if you want to wake up with energy, if you want to have better results faster, even if you're bone on bone, even if you cannot play a sport and you want to play a sport, if you want to get better results, if you want to have a better sleep, if you want to have better brain clarity and speeding up your recovery, this needs to be done. This is the difference between Medwell orthopedic and functional medicine and having surgery as a fast option. Do you really want to go under the knife? Do you really want to go have anesthesia? There's a chance of death. Do you really want to have months of rehab? Do you really want to have a metal apparatus in your knees that deteriorates gradually, which would require you to have another surgery? We have had patients who have had 6 surgeries. And just because we addressed their gut, they had better results. Because you have to understand, the medication that you take, it has to get digested. So if you feel bloated, if you have indigestion, if you have sensitivities that you're not avoiding, it doesn't even get digested. That's why it will not even work as effectively. We don't accept everyone for care. You need to qualify for our comprehensive, non-surgical, orthopedic care and treatment. We accept most insurance plans, including Medicare. My goal is to add value to your life so you're able to do what you want to do and be able to spend quality time, play your favorite sports, play with your family and friends. If you are serious about getting your symptoms handled, our office is for you. Call us, see one of our physicians, call the number on your screen for an appointment, and God bless.